Hello, everyone. My name is Bill Murphy. I'm a member of the small team here in New Hampshire who wrote and then ushered through legislation that is now state law in our state. I wanted to jump on real quick to answer a couple of questions and address a concern, actually. Folks mentioned to me that they felt video was the best way to do this, so I'm doing a video. The first concern was people asking about the best way to get started. And I don't know that I made that clear enough in the first video, but I would highly recommend that you connect with your state medical society. We did that, and I know other states have done the same. And the state medical society, their primary purpose is to be advocates for physicians, but also for patients, given the physician-patient relationship dynamic. Helping physicians, advocating for physicians typically ends up in improvements for the patient as well. So they kind of straddle that line. They also deal with a lot of legislation. So they know the legislative process very, very well. So I would definitely contact your state medical society, try to meet with them, try to explain to them what it is you're about and what it is you're after. If you can sign them on, I'll tell you what, they were critical to our process. So if you can sign them on in the way that we did, I think that would be a huge help for you folks. It's a great place to start. The second concern was, in my first video, I mentioned quite a few times that it's not enough to say that you're going to take someone else's bill and run forward with that. And my caution there really was to not to expect that that bill from another state would suffice for your state, because the laws and the regulations in each state vary. So you really need to learn what exists in your state in terms of state law and regulation, and then make changes that improve upon that. This doesn't mean, however, that you shouldn't look into starting with what other states did in terms of their bills. Absolutely, I would promote reaching out to folks in other states who have enacted laws to improve the treatment of chronic pain or pain in general, and ask if you can get their source documents to use going forward. You can take the best of everything and make sure that it moves your state forward and put it together. I mean, that it's going to help you spring forward in a huge way, so you're not starting from scratch. So yes, I would definitely recommend that if you can get folks to provide their documentation, absolutely reach out and speak with those folks. Lastly, and I hesitated to do this, but I've had quite a few folks look at our bill, the bill we passed here in New Hampshire, and claim that it does no good because it doesn't address the DEA. So therefore, basically, why even do it? Why make the effort? Well, yes, it does not address the DEA. The DEA is a federal level. At a state level, we can't really affect that in a meaningful way. But that doesn't mean that you should sit back and not do anything. It certainly doesn't mean that you should sit back, not do anything, and then complain on social media or criticize on social media. I will tell you this. Now, New Hampshire is a small state. I can tell you hundreds of people, and again, that's not a big number, but in a small state like New Hampshire, it is. Hundreds of patients have benefited by the passing of this state law already. And the Board of Medicine's opioid prescribing rule has not even been updated yet. So when that happens and when that's widely communicated, this will help even more patients. But hundreds have already been helped. And I would offer that I believe the DEA has not gone after more doctors in New Hampshire since the law has been passed, because they know there is a state law. So there's just that little extra hurdle that they're going to have to get over in going after a doctor. So, I mean, just today, and I tweeted about it earlier, I received a call from a patient who I advocated for previously in recent times, who was in the emergency room at a local hospital. And I was concerned when she told me she was there, and then there was a long pause, and she said, I don't need you. The doctor here tells me that there's a new New Hampshire state law and that he now feels comfortable treating her pain. So she was thrilled. So there's a perfect example of where, at least in the case of one patient, it helped. And I'll tell you what, if all the work that our small team did helped just that one patient, that phone call today was worth our effort. And the crazy part is that this was an acute pain situation. Our bill didn't even address acute pain, it addressed chronic pain. But that just goes to show you that out in the field where physicians are practicing, they get general messages and then they run with it. In this case, the general message was that a New Hampshire state law now gives them more a leeway to treat the way they deem medically necessary, which is really what our language says, without regard to any sort of morphine milligram equivalent language. So again, prime example of where you can help people at the state level by passing state law. So I would strongly urge you all, reach out to those who have passed laws in their states, use what you can from what they've done, contact your state medical society to see if you can enlist them as partners in this endeavor, and then go off and work this process yourselves and get some state law passed. The more states we can get to pass these laws, the better off we're all going to be. And that's just my belief in this thing. So thank you all. If you have other questions, feel free to tweet. I know you will, and I'll try to answer them. Thank you. Good night.